everyone, this is Riya Sethi from Manifest, and today we are hosting this panel to discuss about how different is consumer healthcare marketing as compared to consumer marketing. And we have with us Anand Kumar, General Marketing Manager, Baby Care Kenvue, Ritu Mittal, Head of Marketing and Digital Buyer, Shourov Mukherjee, Commercial Lead Adult Vaccine, GSK. With years of experience in consumer health segment, these panelists are driving innovation and excellence in their respective companies. To begin with, let's get your views on the topic, starting with you.
Hey, firstly, it's an interesting topic. I think before I get into the differences, maybe the similarities, I think at the end of the day, everything is in the service of the end consumer. I think that remains the same, irrespective of whether it's consumer marketing or consumer healthcare marketing. The nuance though is the touch point / the means to deliver this end benefit is slightly different. And whether it is the influencers in the ecosystem and the touch points that influence this, and maybe the end outcomes in terms of expectations from the categories are probably a little bit nuanced in the two cases. But otherwise, yeah, I mean, there are some similarities and there are some nuances, is the way I'd like to put it.
Ritu?
First of all, thank you for arranging this, and thank you for this topic. I think it's a topic which is very close to me as somebody who came from FMCG into consumer health marketing, and I have first-hand witnessed some of those similarities and differences. In terms of similarities, like Anand said, at the end of it, it is to serve the end consumer, and hence the fundamentals are similar. It is about identifying the triggers, identifying the motivations, identifying the barriers, and then serving those with the right products, solutions. I think where it is different is probably the factor of trust and credibility is more enhanced. There is an even bigger need to build brand trust and credibility when it comes to personal healthcare. Then there are finer nuances, like as an FMCG marketer, consumer promotions used to be an important aspect, and there are categories in which consumers would switch from one brand to the other due to consumer promotions. But in healthcare, probably that is not one of the biggest drivers or triggers. Again, the specifics could vary from one category within consumer healthcare to the other as well, but it is not as enhanced an area of trigger to drive trial. So there are those nuances which are different. There is, of course, a whole domain of regulatory compliance, which is greater in the case of healthcare, or it is at least perceived to be greater.
Moving on to you, Shourov.
No, I think all very valid points. So healthcare, consumer healthcare and consumer marketing, the big difference is actually the accountability factor. I think that is significantly, has to be taken very seriously. So there is a regulatory environment also you are exposed to in a far greater way than any other, typically any consumer marketing category. The point also which Ritu just made around, your claims. So the ability to make claims have to be very, very well thought through. So you can be whatever attracts you is the newest, latest, best in the country, best in the world. All of those cannot be, you can't find a comfortable niche for that which you can find in consumer marketing. You cannot do that as easily. It's harder to find, and you have to be very, very, very mindful of that. But what is very uniquely different about healthcare marketing is that, typically whenever you do any marketing, any consumer marketing out there, there is no expert point of view. But willy-nilly in the world of consumer healthcare, there is an expert, which is the HCP, which is the doctor. So you will always have to say something about your product or your benefit or the drug or anything in whichever space you are. You have to make sure, or you have to be pretty certain that a healthcare professional will also describe the product in the same way. Now that is unique. So you don't have to find the expert soap user to tell you whether a claim of a Dove soap is correct or not. But you got to find that in the world of healthcare, you cannot have a disparate point of view with what the medical fraternity is carrying. So that, I think, is a very important piece. Differs in consumer healthcare. You have got, there's a whole spectrum from high, which is very, I would say, highly scientific, to less scientific and more care, in the more of care, but less in the cure part. But I think that's something we have to be conscious of.
Influencer marketing. That is something that is gaining prominence. So Ritu, do you think it can play a role in healthcare marketing too?
Absolutely, it can. Like I said, the trust and credibility factor is very critical over here. And I think influencers, specifically the experts on a category, whether it is nutritionists in the case of nutraceuticals or it is dermats in the case of skincare, they can definitely help add a lot of value. They can help add a lot of credibility to what the brand wants to share with the consumers. So not just in the area of the product claims, etc., but healthcare is an area where consumers have a lot of questions and they're seeking reliable information. So these experts can also help in addressing a lot of those questions that consumers have and build more value in terms of reliable information for them. In terms of even the emotional credentialing aspect, if we talk about, so celebrities or influencers which are who are not experts, even they can play a significant role in healthcare marketing, because as long as they are authentic, if they are sufferers or if they are users of those products, they can share their personal experiences, insights, and they hence can add a lot of value to the brand and to the consumers.
And Anand, what do you think about this?
I mean, I'll just build on what Ritu is saying, right? See, influencers have always been there since time immemorial. An influencer can be a celeb or it can be that mom next door. Everyone is an influencer. What's uniquely evolving in today's time and age is as a consumer, I'm not just expecting someone to come and tell me, hey, use this, okay? I'm asking for a little more. And that's the nuance that is kind of emerging as we are seeing it, right? So the consumer doesn't want to just know that, hey, I used it, it worked. They're also looking for experts to pitch in saying, hey, why is it working? What's the ingredient that's going in, right? So that's the little bit of a nuance that's happening in the world of influencers and specifically in healthcare related products, right? Consumers are more curious in terms of, hey, how does this work? What ingredient is going? It could be serious conditions or it could be as simple as skincare, where people are more curious. So that's how the role of influencers per se is evolving. And hence the spectrum of influencer continues. There is just a little bit of over-indexing towards expert influencers when it comes to consumer healthcare.
You see, I think that's a great point, and if I may, I'd like to add to that, is that the world's greatest influence has been around for a decade, which is Google. And I feel in the healthcare space, Google also is the most misleading. So there is so much out there that you can actually be lost in the universe of information. And I think the role of influencers are probably underutilized. There's a lot more influencers should be doing in healthcare, because you really need the right voice. And the right voice will take you in the right direction. And that can come, as Ritu said, from experience of the disease, understanding of the disease, expertise, basic information around science, as Anand said. So I think the ability of influencers to take the consumer in a critical space like healthcare in a right direction is something we should be doing more of.
So according to a report by ASCI, healthcare is the most violative sector in advertising. Shourov, what do you think marketers are doing wrong when it comes to advertising for healthcare, and what are the things they should be mindful of when creating ads for healthcare?
So one is, I think this is a scary statistic what you just said firstly, and not very particularly flattering. But I think that's where it comes from. Firstly, better regulation. So one is better regulation in terms of the advertising space per se. That's one. But I think the biggest challenge is that how do we recruit the right agencies to really carry the communication forward. And in that, and I'm seeing the lines now sort of melting between consumer agents, marketing agencies, and consumer healthcare specific creative agencies. And I think the more we have capability building in making sure that as marketers we only work with reputed and recognized and actually credible agencies, that's going to be the first step you do to really take off possibly 50% of your errors. The second is, like every other advertising today, in the world of digital marketing, social media marketing, content has to be prolific. Now, prolific content needs a system to actually make sure that the checks and balances are being maintained. So I think the ability that healthcare has to find a pace of its own. It cannot mirror the pace of others, and this urgency or this FOMO of matching the pace of other of consumer marketing possibly could be a reason also. So one has to sort of pace oneself slightly better in this, but I think, and being more conscious. So I think if you are not looking at only top line, but really looking at the true impact, social impact or healthcare impact of what you're doing, I think that will build a greater sense of accountability for the marketing you see.
I think to add to what Shourov just said, it is very important for anybody, each one of us working in consumer health or healthcare marketing, to make sure that we are claiming, we are talking about the benefits that our product or brand can actually deliver. Not misleading the consumers is of paramount importance. Although it is not an option for any form of marketing, but I think it is absolutely not acceptable in the case of healthcare marketing. We must claim basis evidence, so science-backed, evidence-backed claims which are not misleading the consumers at any point of time and delivering on the promise that the brand makes every single time is important.
Unlike traditional marketing, the focus in healthcare marketing has to be more on the consumer and not the product. So Anand, what are some of the go-to marketing strategies that marketers in the healthcare segment can adopt to help establish a deeper connection with the audience?
Yeah, again, interesting question. Honestly, I feel that irrespective of what category you play in, solving for the consumer is a non-negotiable, and not just true for the healthcare business per se, right? But then how you solve that may be a little different. And in healthcare, I can give you quite a few examples of where it could be a little different from more traditional consumer space. Here, I think outcomes in terms of health become very critical, and hence, how do you, what's the efficacy of the product that you're selling in the service of that end consumer becomes critical. So that's maybe something that is an opportunity to communicate and talk about, as against the technicality of the product itself. And it's not so, and that's just the start of it, right? There are so many other things in this journey of giving better health outcomes that as marketeers we can influence. We spoke about outcomes, which obviously is the end goal per se, but there could be ways to get there as well. It could be a thing of compliance, for example, in some cases. There is this beautiful anecdote from one HCP visit that I had. I don't even remember the category. It was a syrup for, I think, children, and I don't remember the category exactly, but the job was very simple. There was a good active ingredient that was working. The doctor was like, hey, but it tastes so bad that my patient will consume it and then spits it out. So it can be an ingredient that works, but then the consumer is not complying with the dosage, right? And then there was another company which did the same ingredient and just did a better job of taste. So in that it was a good example that we heard from the doctor, where it was only a matter of compliance, but it is in the service of that end consumer. So yeah, so there is end consumer outcomes, and there is things to the product that eventually help outcomes, and then the journey to get there as well, right? In the healthcare space, especially because you mentioned go-to-market, in our country, chemist has a serious role to play, right? And is the go-to person or the first line of advice is being sought by the chemist. So I think as marketers, we also have it's both an opportunity as well as a responsibility for us to go and give the right education to consumers, to chemists as well. I can give you a simple example of a category that we play in, right? We play in the cough syrup category. But then understanding the nuance of a dry cough is different from a wet cough. The cough syrup has to do two different things, and hence you have to figure out the right syrup to use is something the chemist should know. And as a marketer, you have both an opportunity as well as a responsibility to do that. So those are some of the spaces where consumer healthcare is different, interesting, but eventually in the service of the end consumer and health outcomes of the end consumer.
Ritu, Shourov, do you want to add to that?
Yeah, I'd like to add, I think you're right. There's a fundamental, you said it right. The fundamental difference in healthcare marketing is it's more about awareness of the condition, awareness of the efficacy, awareness of the outcome, more than the product per se. You cannot really build on a product at all. So therefore, the best GTM here, of course, it's relevant in all categories, but really speaking to the consumer where they are most well prepared to receive information and not just product information or an offer information or a launch information. So now that's the key challenge. So where do you, I have recently done a program where our consumer activation and engagement about a particular disease awareness was at golf courses, top 10 golf courses in the country, right? But that's because it was apt, because your product and everything provided, it needed that ability of that consumer to actually have the right atmosphere to understand what the benefit or what the issue was. So I think it's important so it has to be very well thought through. The masterstroke, Anand said, I think is the chemist. That's essentially, that's one key point. I think the second GTM is really hospitals. If you look at walk-ins, OPD walk-ins into hospitals today, I think there would be about 100 million people walking into hospitals every single day. How many of them are we able to engage, build connection with, create awareness around anything? That's the second part. And the third GTM, I would say, is also, you have all the databases today. So whether it's healthcare space for better living, the communities which are jogging, which are, all joining together to fight a particular disease or to heal better. I think those are the communities where we need to get our voice. So I think the ability to segment exactly where we need to be present more is now becoming a big opportunity for us.
So Shourov, you have briefly touched upon the agencies, and since healthcare is a specialist industry and you need specific skills to build strong content, would you rather work with the specialist or working with the traditional creative agency would work better for you?
So I have a slightly different point of view here, in the sense that if you see, there are three things in life: public policy, legal, and science. These are three things, these are medicines. These are the three things that consumers cannot understand. You switch off. The moment you hear something about government policy, you switch off. About legal, you can't read a contract, because these are not things we are tuned to, right? You can't say that in 10 seconds either, or 30 seconds. I think the challenge is in consumer healthcare is that we have to willfully move away from speaking what typically the HCP or somebody else can speak, but talk to the consumer to evoke an emotion or a curiosity or some kind of reaction other than merely transfer of information. And the moment, then there is nobody better skilled to do that than consumer marketing agencies. So consumer healthcare agencies actually have more or less morphed themselves into becoming a mirror of the consumer marketing professional in a healthcare company versus being different and challenging status quo. So I think I would vote for consumer healthcare moving to consumer marketing agencies, mainline.
What do you think, Ritu?
Yeah, so I think I agree with part of it. I have a build on the remaining. I think so we work with both the traditional creative agencies as well as the expert HCP marketing agencies. And the reason is that, like Shourov was saying, it is very important that we are able to simplify science using creativity so that the message that we are giving out is easy to understand, it is memorable, and hence they are able to adopt those solutions for better self-care into their life. If we talk very complicated science, it is not going to be easy to understand or memorable, right? And the traditional creative agencies usually find it have that strength to bring that freshness, to bring that creativity, to create that nudge, to get them to ask the question. In India today, we are sitting in a place where consumers a lot of times are not even asking the questions. Specifically the everyday health niggles, people choose to live with them. They don't ask the question. So you need that creativity to get them to ask the question, to tell them what can they use in a reliable way, but in a simple, creative, easy to understand, memorable way. And that's where the creative agencies come in, and they play a very important role over here. Like, we have a brand called Saridon. And when we were relaunching the brand, I tried to identify what is the emotional experience, what is the emotional journey of a consumer during pain, not just the functional journey. And hence, really nudge on that resilience and ask the question that are you really bearing the pain, and you actually can get rid of it. So that is where a traditional creative agency plays a big role. The HCP agencies are also important because the fact remains, like Shourov mentioned earlier, that consumers do still, for multiple categories, even within consumer healthcare, they go for the HCP opinion, they go for what the HCP is prescribing. So if I am looking for a multivitamin brand, I can take either of the paths. I could choose it myself, but I could also take what the doctor is suggesting, and hence it becomes important as somebody playing in nutrition category to go to the doctors with the right communication. And this communication is from an expert point of view. It needs the industry insights and expertise, and which is where the HCP agencies, the expert doctor communication agencies come into play. So we work with both.
Yeah, I mean, I completely echo what both of them have to say, right? I'd love to have an agency that does a mix of both. Solving for the consumer, both of them are equally important, right? There are some influencers in the ecosystem who need to be delivered the message in a certain way with a certain depth of science, with a certain amount of detailing of science, and that is delivered today best by a hardcore healthcare agency. And then through that journey of care, there is a part where that needs to be simplified, like Ritu was saying, right? And hence, in this entire journey of caring for this consumer, I'd love to get an agency that does a mix of both. And today we see agencies evolving into that space, right? We see the more traditional healthcare agencies pushing themselves to get right creative talent on board, to bring a flavor of simplifying science, and vice versa, where we see the more traditional creative agencies getting medical experts on board, right? So yeah, so the answer lies somewhere in between. I'd love to have an agency that does a mix of both, because both are in many ways equally important in this journey of care.
So thank you so much, Anand, Ritu and Shourov, for your time, and thank you for being a part of this discussion. This is Riya Sethi from Manifest signing off.
Hey, thanks again. Thanks to both of you and to you, and thanks to Manifest. Wish you guys the very best. I think it's a great initiative that you're on to. We wish you the best.
Thank you so much. I think it was a wonderful discussion. Loved being a part of it.